So the EPCORE NHL-2 trial, I think is an important trial because it's looking at a practical way we're going to use these new bispecific antibodies like Epcoritamab in the future, which is probably not as monotherapies, but in combination with standard chemotherapies and other standard therapies we're already using for patients with DLBCL and follicular lymphoma. So the EPCORE 02 trial had a number of cohorts, and one of the cohorts that's being updated here at the ASH 2023 is the cohort 5. It's GemOx, Gemcitabine Oxaliplatin plus Epcoritamab. GemOx, a pretty standard therapy for third-line DLBCL. It's a moderately effective therapy. You know, complete remission rates 30%-ish normally by itself, but in patients who are really treatment refractory, the CR rates plummet. They're about 10%. So that's GemOx by itself. That's historical. So GemOx plus Epcoritamab, the updated results here, and we gave some preliminary results on this about a year ago. The updated results are very exciting. The punchline is that the therapy was pretty well tolerated. Overall, very similar to GemOx by itself. Maybe one difference is the neutropenia rates were a little bit higher. Hard to say exactly, but they seemed a little bit higher than historical GemOx. But overall, other side effects were very similar. The other side effect we'll talk a little bit about is this thing we talked about for bispecifics generally, which are cytokine release syndrome, CRS, and also we should at least mention this thing called neurotoxicity or ICANS. Both of those were mostly low grade in the trial, but there were a few patients that had grade 3 CRS. We have in all these bispecific antibodies usually small numbers, about 2-3% with grade 3, and that's about what we saw here in this cohort. And neurotox also extremely rare, but there were a few patients. The efficacy was really remarkable, where we have complete remission rates with GemOx, I said, especially in treatment refractory patients, somewhere around 10% and as high as 30 for more less heavily pretreated patients. And Epcoritamab, historical CR rates about 39%. The results here were CR rates approaching 60% in most patient subgroups. So awesomely high. Technically, we don't like to compare apples and oranges, but higher than we even see with CAR T-cell therapy, but by a little bit. So pretty well tolerated therapy overall, and also remarkably effective. And we don't have enough follow-up yet, but a lot of those complete remissions seem to be durable. We have patients, many of whom past 1 year and some past 2 years, maintaining their complete remissions. So I think this is, you know, not yet the standard of care because Epcoritamab is approved as a monotherapy, but I could easily see this being a standard of care for third-line DLBCL in the near future. And there are other similar studies comparing other bispecific antibodies with the same approach combined with GemOx. So I think this is going to be real-world, everyday care for these patients pretty soon.